Hi friends, my name is Kosupal. Today we are speaking about pharmacovigilance in a global guidelines. Pharmacovigilance refer as a science-related activities, detection, assessment, understanding, prevention, prevention or drug-related problems or adverse event, drug or ADRS or any another drug-related problems. Global guidelines for the pharmacovigilance are the primary and the ensuring that the drug safety and protecting the public health and the promoting the systematic monitoring and reporting the ADRS. Different in different countries and organizations have their own guidelines, but they are often when the international standardize such those sets by the World WHO are and the International Council of ICH key global guidelines for the pharmacovigilance. The WHO guidelines, the World Health Organization WHO WHO has developed a comparative of guidelines for pharmacovigilance. These guidelines mm, collecting the analysis and reporting of the ADRS and the global level of the level of the assessment and of the national pharmacovigilance centers. WHO also manage the mm, management monitoring the central UMC, which hosts the global individual cases safety report ICRS individual case safety reports database data international conference on the ICH, the organization that together brings together regularly authorities and the pharmaceutical industries for the Europe, Japan, and the United States. It develops the guidelines that horizontally regulatory requirements for the drug approval and the safety monitoring. The E2E pharmacovigilance guidelines ICH E2E outline that the global approaches the pharmacovigilance. The particle includes the safety of monitoring and marketing products. European medicines agencies EMA the development of the own set of the pharmacovigilance guidelines as part of the European on the medicines. These individuals the pharmacovigilance practices, GVP, good pharmacovigilance practices, which which provides the detailed guidelines of the collections, assessment, and the management of the ADRS across the EU. These GVP guidelines, which also monitoring the risk benefit balances and the medicines after the approval. Food and Drug Administration FAD administration, Food and Drug Administration USA FAD Center, the Drug Evaluation of the Research ICDR provides the guidelines of post-marketing surveillance reporting and drug safety monitoring the USA, FDA, the the promoting it is the primary system for the reporting of adverse event drug. Thank you.